in the name of Almighty, most merciful and beneficent. Dear my fellows who are doing any type of postgraduates in internal medicine or medicine and allied elsewhere other than Pakistan or other countries. Now these are the actually sessions where I have made with interpretation of the common X-ray for the PGs and the Pakistan and the foreign examination. This is part 1. I will show you the X-ray chest plane, 10 X-rays. You take your time. Please read brief scenario before the interpretation. Now only positive finding should be picked and diagnosis and differential diagnosis should be made. 1 minute per skygram is given to see it and write on the paper. The correct answer will be discussed after this presentation for the 2 minutes per skygram. The second part of this, the answers are concerned, there will be another presentation which will be uploaded. So take your time and do it. 1 minute or 2 minutes times. This is the first X-ray. A patient undergoing herniorraphy had done X-ray chest as the routine. He has referred for the fitness purposes to the medical OPD. Now this is the first X-ray chest. Now this is the second X-ray, a 25-year tailor, and he has presented with some abnormal electrocardiogram. See the salient features and positive findings in this patient and comment on it. Write on the page or the piece of paper. This is the third one, a 22-year-old diagnosed recently as stage 3 hypertension and with the soft systolic grade 3 murmur at the aortic 1 area. (22-year-old hypertensive with systolic murmur of grade 3 at A1 area. This is the fourth one, a 45-year-old weight lift trainer having the upper chest and the left shoulder pain with occasional giddiness. He has got occasional giddiness with the left shoulder and chest pain, upper part of the chest pain of the left side. Fifth one, a 32 years old having the history of Diplopia and history of increased lethargy. See this X-ray and pick up the positive findings and relate with the scenario which is given. This is the end of the part 1. 5 X-rays were shown in this. Take your time, repeat it. You can see if you want to repeat it again for further time, and then the answers will be shown in another presentation. Match your answers with the part 2, which I will act as the candidate. You will be the examiner and I am the candidate. So I will answer it in front of the examiner in 1 to 2 minutes per X-ray. So we'll see you on the second part of this part 1, second session, with the answers and how will you act in the examination.